The Palm Beach Civic Association expands its communication outreach with a state-of-the-art television studio. We call it Studio 33480, the zip code for the beautiful island of Palm Beach. Sponsored by Finley Galleries, our goal is to bring you in-depth interviews with the most colorful and knowledgeable personalities on the island. And now, our host.
Welcome to Studio 33480. I'm Wendy Rutledge. Today we are here to discuss healthcare and specifically primary care and the importance of it. And we've invited into the studio someone who knows a great deal about this. Please welcome Diana Barrett. Welcome, Diana.
Thank you. Thank you for having me.
So glad you're here. So before we dive into primary care, tell us how you have learned so much and what you have done in the healthcare industry to acquire this knowledge.
Well, my background is primarily academic, but I also did a lot of consulting in different countries. I got a doctorate from Harvard Business School in large-scale complex systems, basically, of which healthcare certainly fits into that rubric or into that category. And I taught at the Harvard School of Public Health for about 15 years. And in that period of time, I spent a lot of time in different countries that were developing large-scale primary care programs. In Cuba, which at that point was really a leader in the area, no longer. In Mexico, after their major earthquake in the late 80s, actually, when I was first there, where they had tremendous loss in the city of Mexico and in the surrounding areas. And they took it as an opportunity to really rethink their medical care facilities and their approach to primary care. Spent a lot of time in different countries, Colombia as well, India, trying to set up HMOs, again, around primary care. So it's an area that I've worked in for many, many years and have a lot of experience in.
Yeah, that's an understatement, yes. Okay, so, beautifully qualified to talk about this with us. So you are a member of our healthcare committee, specifically the subcommittee, which is New Trends in Healthcare.
Right.
And you and that committee are hosting two forums that are happening in November, which we will give all the details in a little bit. The topic is primary care. And I have to admit, I've listened to your meetings for about 9 months now. But when your committee first selected the topic of primary care, I'm like, really? I mean, it's that important? Mm-hmm. Well, I have come to learn it is that important, but can you explain why?
Sure. I think I've been working with the American healthcare system in particular all of my working life. And so I've gone through all of the tremendous waves of change from managed care to not thinking about managed care, to worrying about gatekeeper issues, to specialist care, to self-referral. So we've gone through all sorts of waves over the past 20 or 30 years. And it really fundamentally works out to the most important issue, which is that any human being, whether it's in a poor country, a mid-level country, or a very wealthy country, needs a continuum of care and needs somebody who cares about them and understands the whole person. This used to be much more common than it is now. We all grew up with Dr. Kildare and who's the other one, Dr. Welby?
Marcus Welby, MD. Yeah.
And they rise to the occasion and get up from your dinner table and go help someone that had a stroke and have dessert first, but then get there. And we grew up with this idea that these people exist. Well, these people probably don't exist now. I don't personally have a Dr. Welby. I wish I did, but I don't. But I actually don't wish I did because Dr. Welby didn't know very much. Dr. Welby had limited knowledge because he was a general family care physician. And one of the positives about our healthcare system today, before I talk about the negatives, is that we have specialists who are extremely well trained, who have access to the latest technology, to the latest referral systems, to the latest machinery that they can. They understand pharmacology, so a rheumatologist who is a real expert in autoimmune diseases knows substantially more than any of our Dr. Welbys even imagine they would know, okay? A good cardiologist today is invaluable if you have a complicated or even a straightforward cardiac problem. So there's nothing negative to be said about specialization. It's great. The problem with specialization is that you don't have anyone that's looking at the total person. The classic situation there is, for example, giving a poor person who has all sorts of problems, instructions to take his medication 3 times a day with meals. Well, that poor person may not get 3 meals a day, and it may be very difficult to take those medications 3 times a day with meals. So again, you have to understand who you're dealing with and what the reality is of what kind of instructions you're getting, because if you don't understand that, you're not going to get compliance among your patients. Your patients are going to blow you off, and they're going to not do what you've asked them to do. So we have specialization on one side versus kind of a Dr. Welby, let's say, model on the other side. And somewhere in between is the model that I think we need to think about in this country, which is, and we have a little bit here and there, where we have one person who's primarily in charge of you, who's playing kind of a quarterbacking function. We used to use the word gatekeeper, and that made people really nervous because that was the idea that you're keeping me from seeing people that I should be seeing. So I'm not using that word. I'm using quarterbacking, someone that says, okay, you've got diabetes. Here are all the people that you need to see over the course of your diabetic lifetime, which might be your lifetime, that are all going to increase your quality of life. And it's up to me as your quarterback physician to make sure that you see these people and that I get feedback after you've seen them to make sure we're all constantly working on the same page. So that's the ideal physician. And it doesn't happen very often because people don't see the importance of primary care or that initial quarterbacking function. Primary care physicians don't make as much money as specialists. They have to work very hard and have very large patient panels, which is simply a fancy word for saying how many people's lives are you responsible for. And many of them are burning out early because they just don't want to work that hard, and because they have so many hours of administrative activities that they have to attend to. So they might see patients for 8 hours a day, and then on top of that, have to work on all sorts of insurance issues. We used to have a pediatrician who I loved in Boston when our kids were small, and he had 2 full-time people. I remember this conversation just doing insurance claims, right. And so if you add that to the cost of your practice, it's often really untenable. So I think the great thing about the 2 seminars we're doing is to really introduce people to the idea of what they need to keep themselves happy, healthy, and going forward, what their family members need, and how to best achieve that in our incredibly resource-rich environment here in South Florida, where we have excellent people, but we may not know or have the ability to choose access to those people. So,
and so much to unpack from what you said, which we won't go in real depth with, but part of the impetus that your committee kind of was acting upon seemed to have been the influx of all these new practices, both institutional, huge hospital groups coming in, as well as small private practitioners. But with that, which gives us options, that's a good thing, it can also be dizzying. Is this pair of seminars going to help us with that?
Yeah, I think right now the availability of different kinds of practices is incredibly confusing, even for those of us that have worked in the industry for a long time. In preparation for these 2 seminars or workshops, a number of our subcommittee actually did some site visits, and we went to talk to some of the people that are now setting up practices here in Palm Beach and in West Palm Beach, but we looked at the ones here in Palm Beach, and there are hybrid models that I've never heard of. Okay, I mean, literally, I've never heard of that. It's not really an ER. It's not really primary care. It's after hours, but is it not? How do you pay for it? It's incredibly confusing. And so, if it was confusing for those of us on the subcommittee, all of whom, by the way, have a lot of knowledge in the area, I can imagine what it's like for Mrs. Smith, who moves down here from Chicago and is simply trying to choose a doctor. It is really confusing. So, what we're trying to do is to sort through the tremendous amount of data points, if you will, and try to figure out what kind of person are you? What do you need? And that's a very important determinant, because there are some of us that simply need a lot of hand-holding. Nothing wrong with that. Not a judgment call. If you need hand-holding, that's great. Then you better find someone who is able and willing to do some hand-holding. Other people want the latest information about everything. Other people constantly scour the internet and want to discuss that with their doctors. Everyone's quite different. On top of that, people's health is very different, and it can change as we're all getting older. It can change quite rapidly. So our goal for these 2 evenings is to really set out exactly what the options are, what they mean, what does the language mean, what does a primary care practice mean, what is concierge medicine? We're hearing so much about that. What does that mean? People are completely confused about that. And in fact, there are tremendous differences. So we hope to take an alphabet soup and a soup of all sorts of capabilities. Some of those capabilities are terrific, and some exist in small practices. By that I mean a 1-person or a 2-person practice. Some exist in places like the Cleveland Clinic or any of the large medical centers that in theory have everybody under one roof. Some exist because the individual practitioner is incredibly well connected and is able to refer you to other physicians, potentially all over the country, who have the exact capabilities to deal with your, let's say, rather esoteric disease. So what we're going to do is sort through all of that. Picture taking everything in your cabinet, dumping it into a pot, and sorting it out into 3 terrific soups.
I clearly see the value now, and you explain it beautifully. A lot of people on the island either have concierge care or are looking at it as an option. But one of the things that I've learned from your committee's meetings, that is not a specific term. In other words, concierge care can roll itself out in a number of different presentations.
And it can surprise you because you might think that you're paying X for your physician, but then it turns out that for every visit, you're paying another fee. And if you don't have Medicare, that puts you in a totally different situation because then you're filing an insurance claim for every visit. It could be that if you go get a vaccination, which is of course a very hot topic in the past 2 years, that yet is another fee. So people then become quite surprised that all of a sudden these fees are piling up. So you have to really ask what you're getting. For example, some people expect house calls, and again, that if you have certain kinds of problems, or let's say you're of a certain age or you have mobility issues, that might be a very attractive thing for you and something to be pursued. But what is that going to cost? And are you willing to pay for that? What does after-hours care really mean? I mean, we ran into one practice that after-hours care means that you get a message saying, if you're really sick, go to the hospital or call 911, which is not exactly what I had in mind in terms of after-hours care. Or it could be that after-hours care means that you are referred to a nurse practitioner who might be terrific, but you've never laid eyes on in someone else's practice down the street that you don't know, that doesn't know you, and there are no electronic medical records, EMRs, which are so important. So someone's literally saying, John Smith, who is this person? Oh, they might have had a stroke. I have no idea what's going on. Okay. So again, you have to really figure out what it is that you're buying. And one of the things that we're going to do is to give you those capabilities so you can actually ask intelligent questions and be purchasing something that's more or less along the lines of what you thought you were purchasing.
Exactly. I'm listening to you and I'm going, if I attend these 2 seminars, I might learn the questions to ask.
Absolutely. You will learn, and we will give you information that you can take home with you. So you can therefore, because we all listen kind of differentially, and we listen to something, and a little later we'll say, I don't remember that term, or what did it mean? So we're going to give you a glossary of information. We're going to give you a glossary of terms. So when you go to your doctor, you can ask the questions that really concern you. Everything from the logistical issues, that what are your hours, and if I call it Saturday morning at 11 o'clock at night, who am I going to get? And if I end up at the hospital, will I ever see you? Will you be able to visit me? Or does that hospital not allow that because they don't allow external physicians? So those are all basic questions that we all need to understand. And frankly, as we get older, statistically, we're much more likely to need an answer to those questions than we were 10 years ago. I've had 2 or 3 friends who have died of strokes in the past 6 months. So that's, I mean, literally. So those are all questions that you really need to know. If you had a stroke, where are you going to end up, and what role will your physician play? So without being overly dramatic. I think it's just important to know what you're purchasing and what the characteristics are of that particular doctor. And remembering that, like most things in life, there's a huge amount of chemistry involved. I mean, I remember I had a child who was born with a lot of problems. She's absolutely fine now, but she had a lot of problems at birth. And I remember being told by our fabulous pediatrician that there was a certain physician who I would not like and he would not like me. It was very useful information. Didn't use that physician. But again, you want, and that pediatrician was basically playing a primary care pediatrician role. I saw him for everything that had to do with the complexities of this little tiny body that I was responsible for. And he was very conscious of the kind of people I would like and the kind of physicians who could work with someone like me. So that is a gift if you can find someone who really understands you. And that's what we're aiming at.
And I guess to your point, if you can't really talk to your primary care doctor, where are you?
Yeah, you're nowhere because
Yeah.
you're never going to be able to be. And if you're feeling rushed, if you're sitting there and you're getting the feeling that the person is getting up giving you all the body language that says 12 minutes is a bit long here, then you're going to go home with 90% of the questions that you had and
Right.
probably have a very difficult time feeling comfortable. So when something really goes wrong and this person is giving you advice that's, let's say, tough to hear, you're not going to be comfortable hearing that advice. So, and this is really our goal, in these two seminars, is to really make people really comfortable asking questions and to make the physicians comfortable delivering their information to patients, because in these seminars, they're going to be speaking and they're going to be available to answer questions, which I think will give people at least some sense of the chemistry of the person. If you really think this person has the personality of a newt and you have no connection with them at all, then maybe they're not a good fit for you. Whereas for someone else, they might find that their slow style of speaking and their ability to not get dramatic is exactly what they want. So there's a lot of chemistry in life and in here as well.
Really good point. And the good news is that you will be speaking, kind of kicking off both of these two seminars, so that what we just did here, you will elaborate. You're going to have some visuals, and that is
in a very limited period of time. Yes,
yeah, I know. I'm sure you could talk
but
all day.
But we'll give a lot of other information so people can follow up. I think
Wonderful.
it should be incredibly valuable to people.
Oh,
we hope so.
Me
We've
too.
worked very hard
Me
on
too.
these.
All right, Diana, thank you so much. And of course, these are going to be held November 3rd and November 10th at the Royal Poinciana Chapel, 5 p.m. You can come to both of them. The first one is going to be the large institutions. Is that correct?
Yes. Mm-hmm.
And so that's going to be some of the biggies like Cleveland Clinic and so forth, that type of presentation. And the second one on the 10th is going to be the individual primary care docs. So anyway, Diana, thank you so very much. And we look forward to seeing all of you at these seminars. For more information, please go to our website. You can learn more about it and register to attend. So that wraps it up for us. We thank you as always for watching, and we will see you next time right here in Studio 33480.
Studio 33480 is brought to you by the Palm Beach Civic Association, our sponsor, Finley Galleries, and our viewers. We welcome your thoughts on how our programming can best serve our members and residents.